Hey everyone, welcome to this week's episode of your Weekly TheraTea Podcast. My name is Tel Williams, or Mr. Williams, pre-K if you follow me on social media. I'm a teacher, a therapist, and a social worker. And over here we have the lovely...
I am Anne-Marie DiPietro, and I'm, again, a nurse practitioner still.
Still here. She's
still
still
a
here.
nurse practitioner.
So we're talking about this week's episode, and we were discussing constantly, I feel like, especially when we get new clients, or when I pass a client off to you for meds, or vice versa, you pass them off to me for therapy, we get a lot of like the bad therapist stuff. Also things that we've experienced in our own clinicals and schooling and experiences with therapists.
Or bad prescriber stuff.
Ooh, yeah. And so we thought that would be a fun episode to talk about like the reasons maybe why people have such like a shitty experience and not want to go back. But before we get to there, we have to do our hot take of the week.
Hot take.
It's a hot take. I don't
We
know if that's
need
going
to
to
record
like...
a little jingle.
Yeah, like hot pocket, but to hot take.
Yeah.
Unless that's going to get us in trouble.
Pocket. Hot take.
So we kind of did this a little last week. Mm-hmm. And if you don't want to listen to our hot take, it's fine. You can like
Just
skip
fast
over the next
forward.
like 7 minutes. But we kind of talked about last week, but Jojo Siwa.
Oh my God.
Girl.
Listen, I have had this girl's number for months.
Yeah. You called it some of it.
When we first started filming this podcast, I was like, Tel, we have to do a podcast about how Jojo Siwa is going off the rails.
Yeah.
She needs a lesbian spirit guide. This is not good. And you were like, we can't touch Jojo Siwa.
It's like we can't talk about that. Like we can't. I'm very like, and we've talked about it before, like the like pipeline of like child star to like, you know, a professional adult. It's difficult, and so I always am like weary about it. And it's just like lately, it's like one miss after another, constantly with her.
Well, I mean, it finally like transcended into non-lesbian TikTok, but it's been going on lesbian TikTok for like 8 months at least.
And I think it's because of her new song.
Yeah, and her new song is about the lesbian from social media.
Yeah. That like...
Do you know the story?
Was she like in a relationship with her?
So what happened was there's this really popular social media influencer who was dating another social media influencer. So a lot of their content was all together. They were sort of like one of those couples that like everyone followed. Sure. They like, you know, loved their story. And then all of a sudden, like they broke up. And then like the next day or like within a few days, Jojo and this girl were posting content together.
Like relationship content? Or
yes.
Just, oh no.
Yeah. So they like immediately started dating like in a very public way. And for Jojo Siwa, that's taking them to Disneyland.
Oh my God, girl, I thought we had a ghost.
What?
The light was moving, but your foot was moving the cord.
Oh.
So they went to Disney World together.
That's Jojo's signature move. When she starts
Disney.
dating someone, she takes them to Disney.
It's like she wins the Super Bowl. It's like,
right.
You just won the Super Bowl. Where are you going? She's like, Disney World with my new girlfriend.
Yeah. And it was really controversial because people loved like this couple.
Yeah.
Especially on lesbian TikTok, we're like very like attached to our couples. You know?
I think like what was so weird to me, because obviously I'm not on lesbian TikTok.
Right.
Is this like transformation? Do you know like the meme of like, I think it was Debbie Ryan who's like, I went to the executives at Disney. I said, I want to make history. And that's what this says. If not, I have to show you the video. But it's like, it's just like so cringe. And I think a lot of it is like, she's like, I'm making a transformation no one else has ever made. And it's like, okay, not necessarily true, but great. And then it's just like, there was a huge like BuzzFeed post that I was reading to you earlier about it, where it was like the lack of knowledge and respect of like the people who came before her. So she was like, I want to I went with my execs and I said, I want to create a new genre that's never been done before of like gay pop music. And people were like, Troye Sivan, Lady Gaga,
Which is so
Sam Smith,
ironic
like,
because she wants to name her kid Freddie after Freddie
yeah,
Mercury.
Freddie Mercury. We were Tegan and Sarah, like all these people.
Cher.
Cher, Indigo Girls. You know, like all
Oh,
these.
love me some Indigo Girls.
Right. Well, duh. But like it was like all these things of like, honey, like it's kind of like a like not being able to read the room, or you're going into something that you don't
Lance
fully know about.
Bass.
Lance Bass. I mean, he threw the first brick
Iconic.
at boy bands. So I think it was like so much cringe of that, and it's kind of like that self-fulfilling thing that like if a celebrity, especially, or a social media influencer or whatever, I feel like those are totally different. I do not consider myself a celebrity. I'm I hate saying influencer, but influencer, there's a difference. Anyone that's in a highlighted light or has a platform, it's like you mess up once, and then after that, people are going to critique and like make memes and stuff about that. And so I think it was like at one point someone said that she looked like Gene Simmons, and she was like had no idea the reference. I'm like, baby, like you look like Kiss, which is so fine. You do whatever you want to do, but like get the reference that who like she didn't come up with this look herself. She definitely had a stylist or someone.
Right.
So it's like,
well, I mean, the funny thing is, like, Karma is a Bitch is about, like, this girl that I was talking about. And, like, they literally dated for, like, 3 months. And now it's, like, it's, like, taken over everything. She's, like, eating hamburgers, like, talking shit
Right.
on this girl. Like, I don't know what the hamburger thing was, but it was not okay. I'm, like, not into it.
do you know the tea about Karma's a Bitch?
No, what?
It was recorded in 2012.
Stop it.
Swear to God, it was a song written for Miley Cyrus that she
Oh, I
passed
thought
out.
you meant JoJo did. I was
No.
like, well, JoJo was
Would've
like 4.
Yeah, no, it was written for Miley Cyrus, and then like I don't. It happened sometime this week. Like I think I saw it for the first time yesterday. They found the music video of someone else that actually sang it and did like a full, like it was their song after Miley Cyrus passed it up. So like she's not the first person, and I think sometimes she was like, when I wrote this song. And I don't know if she actually meant I wrote it, or like when I was sampling the song and like wanting to perform it, I picked it because it filled this narrative that I want to talk about. But people were like, you didn't write it, babes. This was written in 2012. Miley Cyrus passed it up, which makes sense because it sounds like a very Miley Cyrus 2012 kind of.
Yeah.
But I think that's like, there's just so many things that like, had people not been like already irritated with her, I think it wouldn't have been a huge thing. But people are so over her that they're being like,
so, this is really funny. So there's this influencer who like built her platform on Jojo Siwa tea. Like
Okay.
that was all she would do. Is like Jojo Siwa tea. Like
And
she
she's
was like
having a
always
heyday.
giving the tea. But here's the funny thing. So like when all this happened with this other TikTok influencer, when they broke up and then she started dating JoJo, whatever, like obviously this girl was like spilling the tea on this,
Yeah.
right? Like ultimately now this girl's like best friends with the ex.
see, that stuff always makes me feel like so weird. You know what I mean?
Why? I think it's
don't-
hilarious.
Like, I think some of it's just like, I think it's just, because I obviously I don't know anything, right? Like about this. I'm always just particular about like, I never want like a friend that I've fallen out with a lot of people on social media, specifically like influencers or whatever, right? And I think can safely say like I don't think I've ever badmouthed them or like joined a narrative of like made sure I was aligning with someone to make it the person like squirm or feel shitty. I think like I'm in a whole different realm than them. They're like if they're A-listers, I'm like Q-lister. You know what I mean? Like.
I mean, it's lesbian TikTok. It's just like
It's like, but yeah, I don't know. I think we just listened to what's the podcast called?
Call Her Daddy.
Call Her Daddy. I'm not gonna lie, it was like the first like time I sat down and listened to one. I'm just
Me too.
TikToking
Yeah.
it. I definitely thought it was gonna go a different direction. Like I thought it was gonna be like JoJo not realizing she was the butt of the joke, but it did help me get a better understanding of what's going on in her world like at this moment, and that like it is cringe, but not in like a way that like it made me still think it's cringe and kind of eye roll, but like I'm not her audience. You know what I mean? Like I'm not JoJo Siwa's target audience.
Right.
So like I feel like it's different, right? I feel like if you're on a lesbian TikTok especially, like it's more of like that you might be the audience and she might be completely missing the mark on who her audience is. But like I would never be part of that audience. So I just
Right.
like listen to the podcast and cringe.
I truly like don't know who her audience is.
Either.
Like my sense as like a 36-year-old lesbian is like she's trying to be cool and it's falling flat. Like that's been my sense of it since like this all started. And I think she's really just like well, I know for a fact she's fallen from grace on lesbian TikTok. So
Yeah, I mean, it's the thing that a lot of child stars I think have an issue with is just like, where do I start? Like, a lot of them feel like they have to do like the Lindsay Lohan's, the Britney Spears, Paris Hilton, even though she was
Mary
older.
Kate
Like,
and Ashley.
yeah, it's like we have to have a bad girl side so that they can completely take us out of this narrative of like,
She literally said those exact words.
yeah, like,
on the
doesn't want to be like
podcast.
bubblegum pop or whatever.
Right. She wants to be gay pop.
Which be among the many others, but
Right.
like. I think it's something where it's like it just comes off like disingenuous.
Yes.
And I think like in a year or two she'll settle into what it was. Like I said last week, we all have those cringe things. I definitely straightened my hair within an inch of its life, dyed it black, and it's like simple plan, you know? And that wasn't me.
I mean, a lot of my patients who are like lesbians, or like newly lesbian, like I think I've talked about this before,
Yeah.
regardless of their age, they've
Yeah.
been like, Emery, you're like a lesbian whisperer.
Yeah.
But it's like sometimes you need someone who's like already like been through a lot of the
Right,
things
right.
to like help guide you.
Oh, for sure.
So that you're not like looking like this.
100%. I mean, I've had clients before who were in their 40s, 50s, 60s who
Mm-hmm.
are, you know, they're queer men coming out for the first time and they're like, how does this work? You
Right.
know? And I think that kind of like gives good segue into the idea of like good and bad advice that we've been
Yes.
given. Like Jojo Siwa needs to be sat down with a good
Therapist.
therapist and be like, hey, let's talk about
And
some
she
of
said
this.
she had ADHD on that podcast.
Yeah.
Did you pick that up?
Yeah.
I didn't know that.
Yeah, I don't know if she's like I have ADHD or if it's like people are always like, oh my god, I'm so OCD, but like they have no diagnosis and they're not OCD.
Well, she did say my ADHD.
Then
so,
hopefully, yeah. So we were talking, and I feel like we bring this up every day when we're talking because we'll be like, because we share clients, we're not given information where we're not supposed to.
Yeah.
We'll be like, you know, I'll be like, hey, I was talking to Bob, and Bob was saying, I'm trying to completely make something up that's not related to a client at all. Bob was saying that he was diagnosed with BPD, but really, he's I feel like he might be autistic, and then you'll meet with him for meds, and you'll be like, yeah, I think that someone definitely lied to him several years ago, and that was, you know, that. And then I don't know, I think because we talked about it so much, I made a TikTok / Instagram reel thing about bad shit that like your nightmare therapist.
Oh my God. Yeah.
Do you personally, I guess, before we get into like what we know about clinic, like what we've experienced during clinicals and school and stuff, have you ever gotten like the shittiest, worst advice from a therapist?
I actually wrote my women's studies thesis basically like about this because I wrote it on emotional violence in relationships. And I think I talked about this before, the boyfriend that went on passion.com and, you know, was cheating with the best friend, whatever. He was like extremely emotionally abusive and sometimes like physically abusive or like physically threatening at least. And like he tried to run me over with a car. He would, like,
God.
He would pin me up against the wall. Like it was not great. And I went to this therapist. I was going weekly in State College, but also remember at the same time, my best friend had just died. My brother had just gotten diagnosed with cancer. My dad had just had a heart attack. So like all of this is happening, right? And this woman was like helping me change. Like it was like, because this guy was blaming me, right?
God,
so like
yeah.
I'm in my like abused era of like,
being
I have to
gaslit.
change. This is all my fault.
Yeah.
Like, what am I doing to deserve this? Like, why am I making him feel like this? What did I do? And she's like helping me problem solve it.
No.
Right.
Like, I think that's the frustrating thing is it's when you have someone that's completely has so much of their like head up their ass that they're not like, because obviously I go to my therapist being like, I know I fucked up and this, and this. And sometimes my therapist's like, yeah, bitch, get it together. And other times my therapist is like, stop, you're not in the wrong here.
Right.
Right? Like I was talking about being abused in high school and not by my parents, not by my parents. And I said something along the lines of like, I should have been doing this. And he was like, no, they shouldn't have been doing it to you, right? It's like this narrative. That's when a therapist stops you and says, oh, honey, the things that are happening in your life and what he's doing isn't things you need to fix.
Right.
Or should stay with him.
Right.
Right?
Right.
Like,
right.
Because it is not our job to, and we shouldn't as therapists decide for them, but we have a duty to say, remember, if we break confidentiality, if you're could be
harming yourself, harming others.
Yeah. Like, there is a time that we have to sit there as, and say, can we discuss it? How do you feel about being, attempted to be run over? You know what I mean? To help say, like, motivational interview and be like, maybe you deserve better, and not be, well, let's fix that so he doesn't try to run you over anymore.
Or like his behavior is about him and not about you. Right.
Yeah.
Like I said that to one of my clients today. And, like one thing that is like really reinforcing to me is like, this has happened to me a bunch this week where clients will come in and be like, Emery, I couldn't wait to talk to you about this.
Yeah.
I needed to like ask you this. And it was one of my teenagers. And she was like, I was in this, first of all, I was like so proud of her because she's like super insightful. But she was like, I was talking to one of my friends and she was telling me, about like how low her self-confidence is and blah, blah, blah. Ultimately, she tells her that she has an eating disorder because of my client.
Yeah.
Because my client's too pretty and she's thin.
Yeah.
And my client says to me like, and I just felt so bad. And I was like, rewind.
Right. Not a thing.
No.
Right.
No.
Yeah.
No. I was like, I understand that you want to be empathetic.
Right.
However, you need to set a boundary of I'm not accepting responsibility for your eating disorder. I will empathize. I will be happy to provide you with
100%.
resources.
Yeah.
I was actually proud of her because she did provide her with resources. She said, she was
sweet.
like, I told her about you and I told her how like I connected with you so much because I could see myself being you someday.
That's really, I love
Isn't
that.
it?
Yeah.
I know. It's really nice. But even like she's so insightful, and even despite like everything she had said to me, which was like so on point with everything, like even she was accepting responsibility for this, even knowing like how to set healthy boundaries with like relationships and whatever. And I feel like that happens a lot where like people accept responsibility for other people's feelings and no one's like, no.
Well, and I think that's the thing. It's like we need to help clients understand what they should be accepting, what they should say. What is that, the mirror thing we were talking about, where it's like, how did you have this happen, or whatever. The reflective, like there are times that it's like, hey, let's think about like what we facilitated in this and root cause of something we did. But other times it's like, honey, we don't need to be doing that work because this has nothing to do with you.
Right.
Like.
Right.
And to be doing that to you is going to be even more harmful.
Right. And I mean, in like romantic relationships, like with my clients, I'll say like,
when your clients are in romantic relationships.
Right.
Yeah.
No. And like, I'm telling them like you can't accept responsibility for their feeling, blah, 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 whatever. Like I will say though, like ultimately you need to be choosing you. And sometimes you have to look at, am I choosing people that are becoming a self-fulfilling prophecy?
Yeah.
Right. And so like that, but you need to be insightful enough as a therapist to know how to present that without blaming.
For sure. Yeah, 100%. Like, and I think a lot of it is validating. It's probably so frustrating because this is something you're comfortable with and it feels good at the beginning, but then you see the pattern, and so we gaslight ourselves and thinking, well, this is different because it feels good at the beginning, because we don't realize that, well, it felt good at the beginning before.
Right.
I think
well,
that's
like our one client, we literally went through the same thing with, and then the next relationship, they were able to set boundaries
100%.
and like walked away and said like, I don't want to repeat this pattern, which is huge.
And I think that's, therapy is learning. It's healing, and it's it's learning, right? I feel like when I go to therapy every Tuesday, even as a therapist, I'm learning something new, right? And it's something that like I can tell my clients and teach my clients, but not necessarily like myself, right? Like, I always call it, I think I've said it before, the Samantha Jones. A lot of my clients right now are going through divorce. And I always tell them the Samantha Jones theory I have, and it's in the movie. I think it's the first movie. Maybe it's the second. The Sex and the City. And Samantha Jones tells, oh God, what's his name? The hot model guy that she's dating, Smith Jared. She says, I love you, but I love me more. And it's not a shitty thing. It's a very accepted, loving thing. And I think it is so important. I think we're all taught, especially women, that this isn't the case. And it doesn't mean that if my husband and I were walking in the street and a bus was coming, that I wouldn't push him out of the way and let the bus hit me or give him, you know, my kidney. But I love me more because I have to, because I'm the longest and most intimate relationship I'll ever have. And I think it is such an uncomfortable thing because it's seen as selfish. And we're not saying that we're putting ourselves in a place where it's like, I don't want to hear about your day because I love me more.
Right.
It's not that at all.
It's about making sure your own needs are met
100%.
While you're meeting other people's needs.
Yep. And I feel like so many therapists just miss the fucking mark.
I know.
I guess this doesn't really have to do with, well, I guess it does. No, it does have to do with relationships. So when I was a freshman in high school, my mother was like, we need to take him to see a therapist because I was like really depressed. I think this was the first time, if I can remember right, that they tried to put me on some kind of medication. And I was like really depressed. I was talking about when I was depressed, and they'd ask why. I mean, I'm like, I just am, which was like a huge like on my end, because to say I just am, I don't know why, when really it's because I'm gay and I don't know how to deal with that, makes them
think... But also you have autism and you have trouble expressing your feelings.
Girl, don't we know it?
Yeah.
But like, I think that, and I guess my mom knew that too, so that's even like a double kill. But like, she took me to see a therapist. It was not a therapist. It was a woman who didn't go to school for any type of therapy, didn't go to school for any type of intervention, nothing, that worked at a church, a mega church.
Oh, no.
That just did counseling. Okay.
Oh, yucky.
And
life coaching,
100%. But I don't even think, I think she was like the counselor, but horrible. So I go to her, and I was talking, I think she got it because she was a lesbian, but like never came out. I think she got what I was talking about, but a huge part of that too was I had at that time full-fledged disordered eating. So like, trigger warning. Full-fledged disordered eating, like was not eating a lot at all. And I remember she sat there, and like, we should have camaraderie with our therapist. We should we should be able to have light moments, I think anyways. But I remember she completely wanted to bypass any of the discuss of sexuality, which is what I was there for, and just talk about the disordered eating, and then goes, do you want anything to drink, by the way? And I said, no. She goes, are you sure? I have Diet Coke. I was like, oh my God. And that interaction just completely turned me off to therapy at all. God. Because she would make comments like that all the time. Because I was a freshman boy going there with disordered eating, like very restrictive eating. And like, it wasn't taken seriously. And I remember being like, oh my God. So when I talk to clients now, I always want to like validate. And I'm like a humorous, a comedian kind of person. But I wait. Specifically if it's about them, because I never want, and I would never make a joke like that. But I remember her saying that, I'm like, worst advice ever.
Oh my God.
Yeah.
I'm like very sensitive about like labeling good and bad foods.
Yeah.
I actually brought a mom in recently, and I was like, listen, I understand like you do your own thing with like your fitness and health, but like I need you to never again tell your child what is good and what is bad for food, because it's stressing her out, and she can at least verbalize that it's stressing her out, right? But like a lot of kids can't.
No. And it's like to put that label on things, because we should be able to like indulge
intuitively.
Yeah. And I think that it's like and I've been trying to get better about it. It's something that it's gonna be hard to break, but like I would say, like, I am horribly dyslexic, or like I'm like really bad ADHD, and people are like, don't put good or bad with a label like that, because it like makes you feel unworthy, or like severity or anything like that. Like, it's just dyslexia, right? And so I'm just like, sometimes my dyslexia is worse than others, or there's a day that it was really difficult, and I think it's relearning, because it's the same with food. If we're saying like, I'm gonna just eat garbage food this weekend, it's like no, like, especially with disordered eating. But there's so many therapists who will be like,
oh yeah,
follow that narrative, or the shitty advice.
Or like when you have primary care doctors who tell your clients they need to lose weight, with like zero awareness of whether they have an eating
100%.
disorder or not. Because at the end of the day, weight like literally doesn't matter when it comes to health for the most part. But definitely when someone has an eating disorder, you don't want to tell them they need to lose weight regardless. Like, it's not about weight.
It's not. And I think that is, so the joke I made yesterday on the thing was a therapist essentially being like, oh my God, are you still upset that your mom's dead? Kind of thing, like, mommy, you should be able to get over it. And at the end of it, the therapist being like, I don't want to talk about that. Let's talk about your weight. You look like you've gained weight. And it's like something that people have told me, therapists have told them. Again, I have that with a therapist. And it's, yeah, you're 100% right. And I can't get along with this narrative of people being like, no, weight does say something. Maybe in some cases, yes. In some cases, yes. Yes, it does. But, like, I had a really good friend growing up who was the healthiest person I knew. Like, I'm talking, like, ran, like, quite a bit each day. Never missed it. Ate super healthy. And they couldn't, like, lose weight because they had, like, thyroid issues, right? But they're like, besides, like, the thyroid stuff, like, all their blood panels and stuff, like, cholesterol was low, like, blood sugar, like, they were way healthier than I'll ever be, way more stamina, better heart, like, all that stuff. And so when you go to a therapist or to a doctor and they're like, lose weight, it's like, honey, you don't know. Because then if she were to sit there and run 12 miles a day instead of 5 and restrict her eating to get down to this ideal weight.
The reality is you could be 300 pounds or 100 pounds, and through disordered eating, your potassium could get low enough that your heart stops and you die.
Yeah.
So, like, at the end of the day, regardless, as like a physician, a therapist, a nurse practitioner, if someone has an eating disorder, you should not be talking about weight at all. Or, unless you're trained in how to treat eating disorders.
And, like, I think because I'm, like, grew up around all girls, right? My mom and my sisters, and, like, always had, like, girls that were friends rather than guys. I think something that I learned early on is that, like, my sisters, again, my girlfriends, they, like, liked compliments, and they liked like, physical ones. And so I always thought that was, like, a good and reassuring thing. And then, like, looking at my sisters with some of their, like, eating stuff, my own eating stuff, definitely my mom's eating stuff, I realized that, like, unless we're talking about, like, I love your haircut. Oh my God, your glasses are super cute. I love the shirt you're wearing. Like, those are pretty okay compliments to give. I love the way your makeup looks today. But to be like, you look good. Did you lose weight? Did you, like, or, like, your boobs look bigger or something like that, or like, oh my God, cinched waist or anything like that. Like, I'm not advocating that you go comment on someone's boobs if you're not close to them. Don't ever do that. But, like, it's like we don't realize what that can reassure.
I've lost weight over the last few years. It's related to insulin resistance, whatever. We don't have to get into it. But, and I think I've said before, I worked at an eating disorder program. I have a ton of patients with eating disorders. And I never realized until I lost weight how inappropriate it is to tell someone you've lost weight, how did you lose weight? Like, sometimes when people said that to me, which is literally all the time, I wanted to be like, I have an eating disorder. I mean, I don't, but, like, a lot of people do.
Yeah.
Right.
It's like, well, so, it's like you never know when.
Right.
And I think that's a good thing to be like, you know, rather than I have an eating disorder, be like, you don't know why I'm losing weight, right? Because you don't know if someone's sick and they're losing weight. You don't know if they have disordered eating. You don't know if they're in grief and it's a chore and a battle to eat. When I think I've said this before, and I think it's hard too because, like, I know they weren't being malicious or shitty or mean, right? But this was like before I found the therapist I have now, right? I had been losing a lot of weight because I had a nutritionist. I was going to see a trainer, and then I started Vyvanse for binge eating disorder and ADHD. And when you're eating 8,000 or 9,000 calories a day, I don't know why this wasn't working out. I almost said 8 or 9 thongs. I wasn't doing that. 8 or 9,000 calories a day, and then you're on a medication that doesn't allow you to binge eat. So maybe, like, I think I dropped down to, like, 2,200 because my nutritionist was like, we need to, like, not send you into shock, but I was losing a ton of weight. And I remember I was doing a musical, and I had lost a bunch of weight. My therapist that I went to had made a comment that like, you've been looking really good. Have you been working out more? Have you been doing this? And it was like, I kept saying, I don't want to get obsessed with the weight loss. I don't want to get addicted to the weight loss. And my therapist kind of was like feeding this narrative, like, you look good, you look healthier, you look this, but like, I was healthy on the aspect I wasn't binge eating.
Right.
But until like there was full regulation of like talking with the like medical provider and the nutritionist and being like, okay, let's slow it down a little bit, right? Because it takes a while to figure out how medicine's going to react with you. I remember I was at a musical rehearsal, and I was like putting my arm on the window of the set. And like we get in the middle of a song, and I look at my arm. I'm like, I had a bruise from here to here. I'm like, I didn't hit it on anything. I'm trying to figure out what it was. And I'm talking to people in the show, and I'm like, oh my God, I haven't eaten in 2 fucking days. And I was like, oh, how did I forget to eat? But like when you are binge eating and then food noise is gone, it sounds silly, but it was easy to forget. And I was teaching full time, grad school full time, touring full time, like, and so I remember I was in the show, and the guy goes, I was gonna say something like a few weeks ago. You look really gross. Like, you look really sick. And I was like, what the fuck? Because then I was like, I feel like I could still lose weight, right? Because again, I was a binge eater, but then you're telling me I look gross at this weight, which for a binge eater would mean that I'm gonna, well, guess I gotta go stop taking the medicine and go eat like 12 Big Macs and gain weight because I look gross. I'm like, we can't be commenting on bodies, people.
Yeah. I mean, it's a topic I try to be really cognizant of.
Yeah.
And it's really hard because we live in this like weight-centered culture. Like I'm very cautious of, I don't like talk about calories. I don't talk about weight numbers. I don't talk about like, I'll talk about someone's thyroid, PCOS, like Lyme disease stuff, like things that can present
Right.
as mental health stuff.
Yeah.
But like if someone's cholesterol's high, I mean, I have to look at the reasons why that may be, but the reality is sometimes it's genetic.
Right. And like a lot of my weight is 100% genetic, right? Because people look at me and be like, you don't look that big. And I'm like, I'm not, but like everything is in my stomach and my back. And that's where my dad carries it. Like everyone, carries it there. And that's like the most unhealthy place to have it. And it's like the place I feel like people are most like self-conscious about. But you're right. Like when we're commenting on that and we don't know the full story, like
Right.
that's not helpful.
I mean, I think one of the most dangerous bad therapist situations is when someone is not well versed in eating disorders
Yeah.
and tries to treat them anyway.
100. I mean, we had a client a few months ago who I said that I was like, we can address the trauma you've had here, here, and here, but I'm not, I don't feel well versed in eating disorders to do that. So like, I think some of it is a therapist or a medical provider needs to have the not have the ego to say, this isn't for me. This isn't my, I was gonna say bread and butter, which is so inappropriate but that's what came to my head. This isn't something I feel well versed enough to
my
like not call.
expertise.
Yeah,
Yeah.
this isn't that. And I think that's okay. But
For sure.
but when you have providers that don't do that, I don't think they realize your one conversation or one session or your one time trying to diagnose someone or get them on medication can ruin it for life. Like,
Well, we were talking about that with Bam last week. Like, Bam says all the time how, like, all of these providers treated him and how, like, fucked up the mental health field
Yeah.
is and whatever. And, like, I understand why he feels that way because
Right.
it was really fucked.
Yeah.
But, I wasn't like that. He knows I wasn't like that. There are more of me.
right. There's I genuinely think, maybe I'm just an optimist, but I genuinely think there's more good than bad.
I don't know about that.
I think that we hear about the bad ones, or the ones that are bad sometimes get it okay and good, and because that's the loudest, people tend to go to them, right? Like, because I don't know, like, I think it's like you have to find them, or I think you can be in spaces like where we're at a pretty small area, especially being in the Philly suburbs. Like, people will go to, if they're in Philly, they're usually, I mean, that's not in our case. We have a lot of people from Philly, but usually if you're in Philly, you can find someone. But where we're at, it's like there's not a lot of fantastic, good, quality people who are
Right.
like client focused and patient
Right. Well,
focused.
and also we should say, like, we're not for everyone,
A
right?
hundred
So,
percent, I'm
like,
not.
our definition of good,
Yeah, it's so different.
I think for me with therapy, it is very important to me that the therapist uses an evidence-based modality.
Yeah.
So, I'm not okay with referring my clients to people who sit there and chat about their week.
Yeah.
Like, I need you to be engaging in some sort of
Right.
evidence-based
Yeah.
therapy. Whether, like, sitting around and talking about OCD is not going to do
No.
anything.
Like, if you are at a place, right? Maybe you're I think every mental health provider should have a therapist. That might be a time where if you've worked through trauma, if you worked through stuff, where you would benefit from talk therapy of this happened this week, this is why it might have been triggering, or I'm having difficulty. But when you're actively in a crisis, or you're just diagnosed with BPD or bipolar or ADHD or disordered eating, if every 3 weeks you're like, I need to come this week because I don't want to create distance, can we take a pause and just for half of the session talk about fun, silly stuff and then dive into it, you
Mm-hmm.
know? But I agree, like to sit there and just be like, let's talk about how this week was
Like
when,
week after week after week
correct,
after week.
right,
Like, it's not that my clients don't come in and update me on how their
right. But
weeks
it's,
have been, but like
yeah,
when I respond to them, I'm responding in an evidence-based way
right.
regardless.
Yeah,
You know what I mean?
100%.
Even if we're like bullshitting about something, like my client today was talking about how she like didn't get on the scale with her dog when the vet was like, I want to weigh the dog. So
Right.
like she didn't want
Yeah,
to get on the
yeah,
scale and we like laughed about it.
yeah,
But like when I responded to that, even in like a
right.
humorous way, I was very aware
Yeah,
of what we were joking about. You
yeah.
know what I mean?
And I think that's what I think is so important. And I think something that I find to be like frustrating is that I've had the number one thing when clients come is they're like, I don't want to be sitting in front of someone who I feel like is taking notes for their dissertation.
Mm-hmm.
And I always say, therapy should always be clinical, right? But with that said, I don't think it should be a non like humanistic experience.
Mm-hmm.
So like you said, like you responded in a comedic, humorous way with the knowledge and understanding of what it was about and in a way that was evidence based,
Mm-hmm.
right? We can have fun and joke. And I think that just proves how connected and on the level that therapist wants to get is to be able to
Mm-hmm.
translate this, clinical jargon who by and large marginalizes
Mm-hmm.
everyday people, myself included. I'll go into therapy or someone will ask me about a specific modality. Um, my program that I was in was practice based. So you learned the modalities, you had to know them, you did, tests and exams on them. But in order to learn them, you did that through practice. Where
Right.
other places are a clinical approach, which means you do a lot of studying. Some of them graduate with a graduate degree without ever practicing, which is
Mm-hmm.
wild.
Yeah.
So mine will be like, all my professors said like the issue you'll have, and I think I've been like, I'll be talking about something, you'll be like, that's this modality or that's this theory. I'm like,
Mm-hmm.
okay, like I know it's a thing. I don't know
Mm-hmm.
who the fuck, what dead white man came up with that.
Yeah, yeah.
But I think that's important. I think that's why, like you said, we're not for every client,
Mm-hmm.
which is good,
Mm-hmm.
but like it's finding that ground of like reaching them at a human level with taking an evidence approach as
Mm-hmm.
well.
Mm-hmm.
Yeah.
I mean, I think the most important thing is feeling heard and feeling a connection.
Yup.
Because when you feel a connection and you feel heard, you're going to keep coming, you're going to be
Yeah.
consistent, and you're most likely to feel better and get better
Yeah.
when you're consistent.
100%. And I think it's like, um, I, I definitely came from this approach that was like, I'm Puerto Rican, queer, from northern Indiana, very liberal. I've arrived. I don't have anything to learn. You know, and I think that's the most dangerous thing. Like, we talk about, like, know your biases. We all have them. Don't lie and say you do. Or you don't. And I remember talking with a client when I was in grad school. And when I was in grad school, I was a therapist. And they had made a comment that was like, and I was at first, like, refuting. I'm like, they don't know what they're talking about. But they were like, I think you should just be, like, even more hyper aware of some of the conversations or the examples you give aren't centered around Black women, and I'm a Black woman. And I'm like, what is she talking about? And it was true. Like, I was like, there's so much things I've learned and gathered and evidence-based stuff that I would be like, it was missed, or the example I was giving, or we would do a lot of, like, homework together, and I would be like, oh, did you read this article? And they're like, you can find stuff out there specifically about how mental health presents in and the challenges specifically to Black women. And I was like, oh my God. And I didn't want to admit, I was like, she doesn't even know. And I was like, this is one of those times you have to recognize your own bias, tell, and 100% be like, yep, this is why the profession is the way it is, because we're like, refuse to kind of do that work. I mean, we don't, we talk about it constantly, but I did 3 years ago, you know? Yeah.
Right. Yeah. I mean, I think I've said before, Colleen and I do couples therapy because I learned a long time ago that my rule was we start dating, we go to therapy.
Yeah.
So I've had many a bad couples therapist. Yeah. Like, I have a very distinct memory of this. So we're going to rewind to broke up with me on the plane, Germany girl that I did the reunion tour after the one that I did the pen thing. And she was obsessing over the friend that died, whatever. Yeah. Anyway, so we had this couples therapist. And the couples therapist had talked to, I almost just said her name, talked to her, I should say her name, bitch. She had talked to her earlier in the day. Like, this person had called the therapist, which should have never happened, in my opinion.
If it's couples therapy,
the therapist should not have talked to her.
Right.
So I had a session with the couples therapist later that day as a result of whatever happened. Right. And the therapist tells me that I'm being insensitive because my Nana dying is on par with her friend's anniversary. And I was like, I don't believe that that's true.
Right.
Like I need support. Like, my needs are not being met.
Right.
And she's like, but you're not meeting her needs. And I'm like, no, what?
Well, correct. I think, like, it's one of those, like, two things can be true at one time. And I think what's upsetting about this is, one, a conversation was had with, you can do like, I've done couples therapy where it's like, however much time.
But you agree to it.
Huh?
It's agree to have the separate.
So it's like 30, 30, 30. 30 with one, 30 with the other, and then 30 together, or whatever the time they want. So I think my issue with this is like, of course we're going to get a conflated idea of our opinion on this. And so when my mom passed away, Jason's father had also passed away. And I think it was like it wasn't like a long time from when my mom did. So obviously there was a lot of triggers. Mm-hmm. And I think the thing is like, could it still be difficult that her friend passed away 18 years ago? We know that, like, grief, it doesn't necessarily get better over time. We just learn to mm-hmm. not deal with it. But, you know, my issue is that it wasn't one of those things where your ex was like, this is a really difficult day for me, and I will be there, even just show up with dinner and a hug and just be like, this is like, I want to be here to support you. It's really difficult, but to still do something, because in that case where you're like, I feel like I would be too in it or what have you, like, is harmful. It's hard for me because, like,
but the issue was that I didn't do anything for her. Not only that she wasn't there for me. Look, I'm getting heated about it right now.
Because for me, that's, like, wildly inappropriate, right? Yeah. Like, that would be like, it's inappropriate in the sense of, like, a day or two later to have that discussion is fantastic, right? For you to be like, I'm still going through this. I want to say, I do recognize the other day was the anniversary of your friend. I'm sorry I couldn't show up for that. after we bury my grandmother,
Right.
maybe it's, I would love to, talk,
Right.
whatever. But like, there are times where like, unfortunately, and especially in a relationship where like it does, someone else's crisis can trump yours. And it is one of those, there's like a huge TikTok going around about this of like, sometimes in therapy, it's like, what was the thing? It's like the most self-centered and shitty person is being told by a therapist right now that they need to focus more on themselves.
Yeah.
And it's like,
Yeah.
sometimes yes, and other times you have a therapist that says, hey, you need to get your head out of your ass.
Right.
And in that case, I've been like, why don't you, I'm going to talk to Anne Marie and let her know that you're having a real difficult time because it's the anniversary of your friend's death. Why don't we have a session that's not a couple session? And so you can not even lean on your therapist. You can discuss what you would like to discuss with Anne Marie, but now's not the time for you to be like, but what about my grief?
Right.
Right.
And so this session happened the day after my Nana died. I literally watched my Nana's heart rate go down to
Right.
0 on the monitor in the hospital at 3
It's a
a.m.
traumatic.
And I was just so invalidated, and like the trust was broken because this
100%.
conversation occurred and I had no knowledge of
Right.
it. And it was, so to me, it was like this therapist just shit talked me
Yeah.
with my girlfriend and then came
Yep.
to me telling me that I was wrong.
Yeah.
I have never done this in my life, but I'm going to tell you this right now. It was virtual because it was like height of COVID.
Yeah.
I slammed my computer down and I never saw this woman again. Like in the middle of the
Right.
session, closed my computer and I was like, it's done.
It is so read the fucking room, right? Like, there's been so many times I have a client come in and they are in crisis, and I mean in crisis as in like they're not always safe at that moment with themselves. And for me, it's to be like, you're in the wrong right now. And actually, it's like, that's not the time. But it's not a time that we gaslight or lie to them either.
Right.
So the fact, though, that like, and there's no gaslighting or lying to you. It's not like they should sit there and be like, you should feel bad. Because that's incorrect. It was one of those things where it's like, I'm just going to say Barbie would be your ex's name. Barbie, I understand how upsetting this is for you. Right now is not the time to bring this up to Anne Marie. Right now, let's sidebar this, and what can we do right now to kind of diminish without involving Anne Marie, because she does not have the capacity
Right.
for this. Because here's the thing, when we lose someone, when we're grieving, grief is not the time to feel guilt, and we have to love a person enough to know they're gonna say and maybe do some fucked up shit, because we are not built to lose people. So like, it sucks. That doesn't mean we should be a punching bag for them, but we
Right.
have to have grace.
But here's the thing. This is why it's important to have an individual therapist and a couples therapist.
Yup.
Because the function of an individual therapist,
Yes.
if Barbie had
Bleep that out,
one,
bitch.
no, leave it in there at this point. It would have been to have that conversation with the
Yes.
individual therapist.
Yes, I agree with you.
And I'm going to tell you right now, if our current couples therapist was in that situation,
Right.
she would have not talked to Colleen about it
No.
until like we had a conversation where we
Right.
all agreed with what was going to happen.
Yeah.
And like my current couples therapist, I've seen her with I actually think that I might have seen her at the end after I slammed the computer on that therapist. I think Barbie and I started seeing her.
And just-
Oh, right. Yes, because we missed an appointment the night that she locked me out and we like ended.
yeah.
And I was like, I know it might be weird to like continue being my couples therapist through like other relationships, but like I need
Right.
you, because she does Gottman therapy.
Yeah.
So I'm like very big on like evidence-based couples therapy, and I like for it to be more focused on like Colleen and I having the conversation with each other with someone like
Facilitating,
guiding
yeah.
it, because it's like so uncomfortable that you need someone to like push you to do it.
Which was shocking when I found out that that's not how sometimes it works. Because
For sure, no.
A lot of times when I do couples therapy, like I said, I talk to one person, I talk to and this is all within the same session. I talk to one, I talk to the other, and then they come together at the end of the session for 30 minutes, and I will ask them before they leave, what do you want to bring up to them? Cool. Next person comes in. What do you want to bring up to them? Cool. We come together. I say, okay, who would like to start? And then I sit back for most of it, almost all of it. The only time I'll butt in is like, ooh, can we make sure we're listening? Or I want to hold you accountable to what you wanted to say to this. But if you're not ready to talk about this week, that's fine. You know what I mean? But like, it's tricky. But I also feel like it's also at the therapist's discretion too, if they feel like they feel more of like an alliance to someone, because you shouldn't feel that. So if a therapist is like, yeah, but like we can try out a session or two, but if I feel like I'm more siding with you than Colleen because I've had you prior, we can ixnay it.
She literally said exactly that. Like, not really that, because like there was never a doubt in my mind that she wouldn't be unbiased, but she was kind of like, I just want to make sure that like you're okay with this.
Right.
And like I've literally never felt like she was taking sides.
Good.
And it's one of those things where like it took me a long time to find her, and I had a lot of really bad couples therapists.
Yeah.
And it's not even that like I have like an emotional connection with her, like that you would with like an individual therapist. I feel like it's sort of more like I appreciate like the guidance and direction and feedback that she's able to like give Colleen and I for like Colleen and I to navigate ourselves.
Yeah. And I think that's like a super important thing too. And I like that you said, you know, the emotional connection, because I always say like the TikTok, there's a really good TikTok of a therapist saying like in school, and I know that you definitely went through this, you are not taught, one, you're told to be emotionless. We're not robots, but you're not taught how to feel when a client stops seeing you or does not need to see you anymore. And that's hard. And so it's completely bogus to sit there and say we can remove ourselves completely from emotion during that. But there has to be some type of professional and clinical tie between you and your therapist. And again, nothing that's enmeshed, nothing that's inappropriate, nothing that, but like it comes down to empathy, right? And if I'm talking to a client and I can't feel empathy towards them, they should not be my client. And the same if you're talking to your therapist and you're not feeling empathy of what they're discussing or being receptive to that, find a different therapist. But there is emotional connection to that, 100%.
Yeah. I mean, one of my clients actually gave me the idea to like talk about this today, because she listens to all our podcasts and you know, whatever. But so I think it is a really common experience for people to not find someone that they connect with.
For sure.
Or particularly for medical providers to find someone that listens to them and validates them.
Yeah. Especially medicine wise, right? Because, God, there's so many clients that will be like, I wanted to potentially get off or try something different with this med. Like, should I like bring it up to Anne Marie? And I'm like, yeah. I'm like, why wouldn't you? Well, when I saw a doctor about this, and I'm like, oh, I get it now. Because it's like, and like you've said, be like, oh my God, am I not approachable? And then I'll talk to the client like the next week and like, no, it went really well. I think I was just this. And 100% that's correct. Like you're right. I think people are so harmed by the medicine and medical aspect of mental health that it like turns them off to it completely.
Yeah. I saw a client today that I actually diagnosed with autism, but like if you look at like the first half of the session and the second half of the session, it was totally different. Like the first half, it was like pulling teeth. Like I couldn't get anything out.
Right.
And then there was like this shift after we had a conversation about how I wasn't going to force him to take medicine, like after this appointment. I was like, yeah, let's do genetic testing. Let's keep talking about it. I know it's really hard when you have anxiety about medicine for
100%.
anxiety. So like we just need to keep having these conversations. And then it was like he just started pouring stuff out. And then we had like a very like effective reciprocal conversation after that. And it was just like one of those reminders that sometimes people just need to feel like you can meet them where they're at.
And I think that's like a thing, especially when I was in like internship and doing clinical stuff, because like in our program you do like a rotation everywhere. kind of like you would with like nursing or being a physician or whatever. And a lot of it was psychiatrists specifically who had been doing this for years, right? And are overwhelmed. Like, I'm not denying that. To see 4 patients in an hour and have to do diagnoses and all that stuff, and this wasn't even med check. Like, I get it, but like to see they're just not in it, or they're and they're not being receptive and not meeting them where they're at. It's just like they're programmed to just go the next to the next, the next, is something that was horrific to me doing community health. I was like, I've if you're wondering why sometimes we get tripped up, is because we have to because of ethics and what we want to do. We change stories enough that like, well, this happened yesterday, happened a year ago. It was this woman came and talked about this. It was a man, so that people don't feel like, oh my God, it's me. So I was trying to go through how I've changed the story to talk about it before, but you'll get the gist of it. I was seeing a client who needed to be observed by a psychiatrist who had a past use of substance bonding or addiction. This was not an active issue they were currently having. They had not used in like 10 plus years, all that stuff. They had an extreme amount of anxiety talking to psychiatrists because they were denied medication they needed for ADHD because of prior drug use. That wasn't a stimulant, wasn't methamphetamine, so none of it made sense. The psychiatrist, the client had to see me 3 or 4 times before you're allowed to even book with the psychiatrist. What we did is I would give them a direction, I think, to look. Then the psychiatrist would get on for 20 minutes and diagnose. The psychiatrist calls me. I asked my client how it went. She was like, terrible. The psychiatrist calls me and says, I would love to talk with you. This was one of the worst things ever. I stopped talking to her after 5 minutes. I got off of all the shit. And I was like, what the fuck happened? Come to find out, I sat down with this psychiatrist, me, and my supervisor. I haven't graduated yet. I'm still a graduate student. And he says, she was talking a mile a minute. She was so nervous. I saw that she had past drug use. Is she currently on drugs? I'm like, no, she was very nervous about this because she's been gaslit about her mental health, about this. And he's like, and I'm trying to like figure out how to word this because it's going to be like really jarring. So just trigger warning. He was like, she's also pregnant. Is she going to have an abortion? She's a terrible mother. She's not a terrible mother. She's a fucking fantastic one. And I was beginning to peel my cuticles under the table. I mean, ripped them to shreds. And I try to keep calm. And it was you who told me this, that people with ADHD that go undiagnosed will, at a higher rate,
untreated before the age of 12.
They have a higher rate of substance bonding or substance addiction. And he goes, yeah, I guess you're right. I forgot about that. And I was like...
Well, and I had sent you a bunch of articles on like why you need to treat ADHD and substance.
Yep. And the issue he had is she was on a like 5 milligrams, if not less even, of Adderall. Not long acting. She only took it once a day. It was a very low dosage. And he's like, well, she's pregnant. She's going to have to get off of that. I said, I'm not a medical provider. I don't know. And I said, well, who gave it to her? I said, her OBGYN. I said, because she literally she was waiting for you for like, she had to do 3 or 4 sessions, and she had a lot going on. So like she wasn't able to do them back to back. So she waited like 6 weeks in crisis. And I was like, you can see that. But I remember being like really upset.
You were really upset.
Oh my God. I mean, I was like almost in tears. He leaves the room. I start bawling. My supervisor's like, are you okay? I was like, I think this was a good moment of me realizing like the things we have to do, the things that, how I need to talk to psychiatrists and stuff. And she was like, I've been here for 15 years. People love the psychiatrist. I think he must have had the worst day of his life because this is so not him. But she didn't leave it at that. And excuse it. She went and talked to his supervisor. They had a meeting with him. He later talked to me. He handed the client off to someone else. He had a conversation with the client of being like, you don't have to say anything. I apologize for this. I'm gonna hand you off to this doctor instead.
That's very rare that any of that happens.
It's so rare. Because, and I remember my supervisor was like, people love him. Like, they will request him because they've heard about him. And I was like, ooh, that's not my experience now. But I remember sitting there and being like, this is why people don't go to therapy. And because of this bullshit that happens. And again, people feel like they're not heard, and she didn't feel heard. I'm like,
Right.
oh, baby, this wasn't cute.
Yeah. I mean, I think a lot of people get the sense of like, especially with prescribing psych meds, like you just have to accept what you get.
Right.
Like you go see someone, they're the person, they're going to give you meds, and like whatever they say goes.
Yeah.
And I can't tell you how many times patients have said to me, I was seeing this provider and they told me like maybe this is as good as it gets. And I'm like, excuse me, what?
Right.
And especially with medications that cause weight gain and sedation, their providers have said to them like, well, would you rather gain weight and be sedated or be depressed? And I was like, how about we shoot for none of the above?
Yeah, and I think that's like, again, something so frustrating because it's the same as like we both had a client that we shared that was like big into like I'm trying to again flip things in my head, wrestling, and weight gain was a huge thing, like wanted it. And so to put him on a medicine that would cause foods or appetite suppressant was definitely something they didn't want, right? And so it's but there's other options out there. And so I think it's an unwillingness to get out of what you just feel like you know and you're stuck in, and to do more work, do research. There's so often that you're like, a new study came out about this, and I'm like you're not done learning because you're out of school. That's not how it works, babes.
I tell my clients all the time, like, I know what I don't know. And even if I think I know something, like, I'll look up more.
Right.
Like, I'm always finding stuff. And I think I'm particularly interested in, like, how physical issues can present as mental health issues. Oh, very... kick the med.
Bam!
But like I had a patient once and his psychosis had been stable for like years, right? Like it took me forever to like get to this place, and then all of a sudden the hallucinations came back and I was like, what? And they were like, Anne-Marie, we need to change the medicine. Let's do something else. I saw a commercial for this and I was like, something's not right. So I pulled their medicine list and they have been filling prednisone for like 5 months. And prednisone is very well known to activate psychosis in people with bipolar or schizophrenia. They had this rash that they were seeing dermatology for. They couldn't figure out the origin of the rash, so they kept putting them on prednisone. And I was like, we're not changing your medicine. Like, you need to get off the steroid.
Yeah.
We'll tack on a little Thorazine for a few days and, like, let's not polypharmacy this up.
Right.
But most people would have just been like, you're right, your medicine's not working. Let's do this.
Right. They do change the whole thing and not like, was prednisone what I was on when I, what happened?
Yeah. When you had, oh shit.
Why was I on
What
prednisone?
did you have? I remember.
Because they said a steroid would help with that. What was it?
Was it the thing on the back of your head?
No, that's what I thought so too. But I remember being like, I'd rather have this. The doctors gave me. It was.
Oh wait, it was.
It was around Christmas
it was
time.
Before. It was when you didn't want your lips to swell before you
Oh
got
my
filler.
God.
That's so embarrassing.
Guys, listen. I went to go get filler and I had to do like a social media thing, and I was visiting a friend in St. Louis. And I went to go, it was filming for them, for the place that was doing the filler and stuff. And they're like, do you swell? I'm like, yeah, I swell a lot. And they're like, okay. And I was like, I don't usually bruise though. I hadn't bruised until this time. So they said, we can give you prednisone to help with the swelling so you won't swell as much. And then they told me to use this gel stuff that should have worked for the bruising. But then, and I swear by this because they gave me the things. They gave me this like ice lip things you can put on.
Oh my God, you were obsessed
Yeah,
with that.
that actually can cause bruising. Prednisone, I did not know causes moon phase. Like,
Oh.
so quick. I thought you had to be on it for like weeks or months. And they gave me like they gave me 10 days worth or something like that. Something silly. I remember them saying like, you don't have to take it for that long though. But I was like, oh, within like 2 days, I was like, God, I'm drinking water constantly. I don't think I'm peeing. And I remember looking in the mirror and being like, what the fuck? My face was like perfect, gorgeous little moon. Like I just went past an eclipse moment.
Mm-hmm.
Prednisone is like some serious shit.
Yeah, and I mean, in psych, like really anything can be
Right.
serious shit. Like, I mean, that's why you kind of have to like go to a provider that's conscientious and like
Right.
you feel like cares about you.
Yeah.
You know, like I have a lot of clients. I'm not saying that like I have like all of my clients feel some
Right.
like intense personal
Right.
connection with me
Right.
or whatever. But like there's something they like about me,
Yeah.
right? And I would hope that if they didn't feel a connection to me or they didn't feel like I was helping them, that they would tell me that. I mean, I've been in the position before where I've said to clients like I need to refer you to someone else because I
Yeah.
don't think we've made progress. And
Right.
they're like, "No, I'm not leaving." I'm
Yeah.
like, "No, but really?"
Yeah. Like that's the case where you can be like, you can come to me for talk therapy then.
Right.
But
But
no.
like I'm out of ideas
Yeah.
and like I want you to be better than this and
Right.
like I can recognize that I'm just spinning my
Right.
wheels.
Yeah, and I think there's time, not I think, like, and I also am always big, I always tell clients, I don't have an ego when it comes to therapy. So, like, if we don't jive or you don't feel great with me, let me know. I'll refer you to someone else.
Mm-hmm.
Like, I just don't have an ego when it comes to it. 'Cause I
Yeah.
think I'd rather the person be healthy and happy than to be like, no, I can do it.
Right.
So, there's sometimes that, like, I'll have a client that's talking to me and I'm like, and they'll be receptive because one of the things that in the intakes is like medication. Are we opposed? Are we not opposed? If they're willing to take medication and I'll be like, hey, I think that we're at a point where like I would love to do more work with you, but I feel like some of the needs are above what I can do and you might need to see like Anne Marie for if you need if we need a formal diagnosis and medication because like I'm not silly enough to be like I can totally talk someone out of mania who has bipolar disorder and they've been manic for 7 months. Like there's only so much cognitive work you can do before like any other thing. Like you wouldn't be like I can just eat better if I have diabetes. No, baby, it's not about eating differently. It's about you have like shit going on with your insulin. Like,
Right. Right.
I don't know. It's
But ultimately, and like as I'm thinking about this now, like I think the most important thing is that like your client feels like they can talk to you.
for sure.
So like if it's like Emery, hey, it really upset me when you did this.
Yeah.
Or like I've been told by clients that I've triggered them before with like something that I've said and like that's important. I
Yep.
like learned from that.
Yep.
Like I've learned a ton about eating disorders and like things I've done wrong and that kind of thing. And like I think when my client, like a client said to me a few weeks ago, like, I feel like you're kind of like rushing at the end today. And I was like, I'm totally not rushing. Like,
Right.
I'm just trying to tell you like how proud I am of the work you've done and that I
Right.
think you're doing really well and
Yeah.
whatever. But then I thought, like, I reflected on it later and I was like, maybe I was kind of
Maybe I
like
was feeling rushed. I didn't realize it. Yeah.
So, like, I keep my ego out of it also. That
Yeah.
doesn't mean that things aren't hurtful sometimes.
For sure.
But, I ultimately want what's best for my client.
Right.
Sometimes I don't agree with what they think is
Right.
best, but as long as we have like a solid working relationship,
100%.
I would never want to see someone again who like didn't feel connected to me like
Right.
just for myself to feel
Right.
better.
Oh yeah.
Like it feels so much worse when a client like isn't getting better.
Right. when the time and time and time again you're seeing, and you know it's not from lack of them trying and or wanting to be better, it's from like you're not being as effective as you could be, right? I think that's the thing too. It's like it's not that like you're not effective, it's that for some reason you just weren't being as effective as you know you could. Like that's something that I've been like when it happens I'm like, yeah, nope, they're 100% right. And like you said, I would I always tell the clients that when we're doing our work, I will always bring it back to what the goals we set for the goals you set for yourself that I helped facilitate and write down, right? Because again, like client oriented, client centered. But there are times that I'm like, if I'm pushing or encouraging that we really deep dive into this trauma and we've been at it for 35 minutes in an hour session and you're just like, I need a fucking second. I would rather sit there and not, like, I'm always going to encourage that we are never crossing our boundaries, but that we are pushing ourselves. But I'm also not, I don't ever want to put a client in a position where they've over pushed themselves and now they don't want to come back next week. Right? Because like if that would mean that why don't you go to the waiting room and make a coffee, come back and we'll talk about the Real Housewives. And then at the end we'll check in.
Right.
Because sometimes it doesn't mean that we're not being, again, evidence-based or client-focused. It means that like that's what they need at that moment. And I'd rather you come back next week than for me to say, yeah, but we really need to talk about
or
this.
sometimes it's a good space for some self-disclosure.
Yeah.
Like I did that with a client a couple weeks ago. I could tell they were getting super overwhelmed with what we were talking about because it was like a lot of life changes and whatever. So I just told them a story about like the last time I was in a situation where I was totally overwhelmed and I was having that like ADHD paralysis, because it like gave them a second to like not be like super in like their own shit.
Yeah.
And then they were like, it actually makes me feel better that like you went through it and like made it out on the other side. And I was like, listen, sometimes I did not make it fully out. I'm like still in there a little bit.
Yeah.
But, and like, I'll be honest with patients too. Like the day I was avoiding my email because it was stressing me out so much. Like I had a bunch of clients that day that were struggling with like finishing tasks that I was like, listen, I'm like right there with you today. And then I held myself accountable and I was like, I'm not leaving this office until all of my emails are answered. And it sucked.
It's right, because you're like, you had like 140?
155. I probably have 100 now too. Yeah.
No, I think that's another thing too, is like when I was in school, they were like, self-disclosure is a tool that should be used when it is beneficial to the clients. And I think that there's both ends of that spectrum, right? There's that therapist that tells you too much about them constantly all the time and sessions feel like it's about them. And then there's the one that's like completely refuses to like, there again, talk. Someone was saying that their therapist, they can't even ask their therapist, I'm good, how are you doing? Like they can't even, like they sit down, they have to immediately start talking. And I'm like, that is not at all, at least the way in social work that we like build rapport, right? With that said, I'm not going to disclose. And a lot of my clients have either found me because of social media, or now that because of the way our fucking phones work and it's creepy, we'll have 3 sessions. They've never seen me on social media, and then all of a sudden they're like, oh my God, you came across my FYP, right? They could even know that. And there are times in social media I disclose something that, like when Teddy had surgery, when Jason was sick last year. But like, I'm not going to talk about my personal day-to-day life, right? But with that said, I've had clients come in that are looking for a therapist who understands because they get it, because they've been through it. So I've had clients that be like, I'm dealing with the loss of my dad, who, I haven't really found time to like sit with it, or like the loss of my mom. And I'm like, oh yeah, and they'll be like, have you had a loss? I could sit there and say, well, it's not about me, or I have had losses, I get it, but I'll be like, yeah, I lost my mom like 7 years ago, and they'll be like, I'm so sorry. I'm like, yeah, it was difficult, but and I turn it right back to them. Yeah, it was difficult, but like I empathize, and I know like what you're going. That must be really hard. How are you dealing with this? Just so that they're asking me a question. I'm not lying to them. I'm disclosing as much as I want to, which as much as I can. But I'm not like, yeah, let's talk about it for 40 minutes now.
Yeah.
Right. Like, and I think that's like such a nice tool, especially with ADHD, for you to be like, yeah, I'm having a difficult time with my emails, because it makes them go, oh my God, like, not only is she like a medical provider, a board certified fucking nurse practitioner doing this, but she like also has the same difficulties I do. So it's like, I don't have to have it all figured out and be 100% perfect all the time. It's what we tell clients. You can't win or lose therapy, right?
Right.
You don't win or lose
and you're
in your
not
mental
good
health.
or bad at it.
Correct. Like we're not 100%. So I think like humanizing the experience. The first thing I'll tell clients, and every time, every Tuesday at 9 o'clock, I go to therapy. And like, you see a therapist? I'm like, yep, I sure do, every Tuesday at 9 o'clock, because like, just because like your doctors are going to doctors, right? They're not like,
Yeah.
I mean, sometimes they are, but like,
well, since college, but
Yeah.
we were required to have one
Yeah.
in my grad program.
oh, they highly were like, if not, you should go to the school one. Like, I mean, it's why I went back and got an evaluation done. I think when it comes down to it, when I post that video, my main thing is, if you have a therapist who is making you feel like shit, or is dismissing you,
or you don't look forward to, not even look forward, if you dread going.
Yeah, and it's not like because it's difficult to talk about. It's I'm dreading because I don't want to talk to them.
Yeah, because
Right.
you're not getting anything
Yeah.
out of it. That happens with teenagers all the time. All the time.
There's such a difference. We were talking about it today, y'all, because I'm like, we like refer clients to each other. That's how this practice works. And I'm like, no kids, never. And then it was fine if they're like 17 or 18, fine. But like it
But
was
then I decided that
like,
we were going to be flexible. I was like, you're seeing this person.
And it's because you said, were they super like unengaged and like rolled their eyes? I'm like, no, we like kikied. We talked the whole time. We did this. I used their level clinically of like, it's because like I know I'm good at that, but it's just like, but I think, I don't know. If teenagers are a great example, because they're going to go because they don't want to go, and that's fine. But do they not want to go because it's difficult, it's hard shit, it's emotional, they don't want to talk about it, hormones, all that? Or do they not want to go because they don't want to specifically see, like, you are the issue, right? And there's a difference in that. We have to know that, right? Like,
I mean, I tell parents all the time, like, if you're having to fight with your kid to go to therapy, it's not working.
no.
Like,
I did.
maybe if you fight to go to the first appointment,
Correct.
like, that's
Yeah.
fine.
And I think it's also like, it always depends on your clients, right? I had a client who could not go without therapy, and knew they couldn't go without therapy because they would like, what's the word I'm looking for? It's blank, it's there when you manipulate. They would do something really, really bad, and they would go, and I'm going to say, like, I'm talking like, rebellious teen, not like mental health bad, like, and then when they would get caught, they'd be like, I need to go see a therapist, because they knew that if they said that, the parents wouldn't ground them. They'd go to 2 sessions with a therapist, and then they'd be like, well, this therapist did this, and I don't like it, and I cannot see this therapist. And eventually mom was catching on what was going on, and so we did the first 2 sessions, and they were good, and we talked and all that, and then they just decided, well, this is getting in the way, I'm just really tired after school, I don't want to go. And so I was like, okay, is it that they want a different therapist? And mom's like, no, it's not about you, this is kind of what they always do. So I said, great, they're still going to come, and when they come in, we have to do give me they loved Euphoria, the TV show. And so I think they were 16. I was like, so I printed out a bunch of Euphoria pictures that had different emotions on them. I said, you have to tell me 3 emotions you felt this week. You don't have to tell me why you felt them. You just need to give me those 3. And they did that. I said, great. Now we're going to spend the next 55 minutes. You can do your homework at the desk. But if you don't, because they wouldn't want to talk to me. And so we did that for like 2 weeks. And then the third time they were, God, I'd rather just talk than do homework. So they're like, well, this happened this week. And then it was great. I want you to pick up 3 cards and you need to tell me about one of them in detail. And then they stopped doing homework and they wanted to come, right? There's been other clients who don't want to come, and I've told mom and dad, hey, this isn't working. I think they're not ready.
Here's the thing, though, that is true about what you just said. You adapted
100%.
for that client.
Yup.
Most therapists
Aren't going
would
to.
not do
No.
that. So
No.
they would just have the kid
Right.
come and be
Right.
completely ineffective
Correct.
every week
Yes.
versus you were actively engaging in steps to engage the client.
Right, because we might say, I need to go to therapy. And then when we get there, we are not ready, right? We could just be like, I'm not ready. And it's not because of the therapist. I'm realizing it would be more harmful. I'm not in a place in my life where I can always, stop the bus. I'm not there yet. And then there's other times where it's like, I'm feeling anxious or like this is a lot to say to one person. I am ready. It's uncomfortable to sit there and like disclose all this to one human that you don't know. So sometimes it's one of those things of like, just show up. You know what? Let's just show up and we can adapt until that you're ready. Like I said, if it's 10 minutes one day, if it's 15 minutes the next week, if it's, to get there. But I think, again, it's the adaptability. Are you with someone who's willing to do that? Or are they just like, no, sorry, you're not talking about the horrific trauma that took you 50 years to come to therapy for. You're done. Don't want to see ya. No. Bullshit.
Yeah. Yeah. It's rough out there, man.
And God, isn't it though? Thank God that like we've both found good therapists for ourselves. And that for the most part, I think like I've never had a client be like not jiving or like me, at least for the most part. I'll say it's been like a mutual agreement of like, I don't do that style of therapy, or like I said, disordered eating or something. Like I don't feel let's do that, and every client I've had that has used been like, oh my God, I love her. Which is great.
Yeah, I mean, I've definitely had clients who didn't like me, but
Girl, I'm
that's
like,
fine. It's been 13 years,
yeah.
so.
I mean, I'm still starting out. I did have that one client you referred who was like, I'll try him out for a week. And then she was like, he's making me talk about trauma. And I'm like, we kind of, we're at that place where we have to. And like I said, she was not ready, and that's okay. So it's like, okay, well then.
Yeah, and then I had to like pivot with her, and, we're
doing great.
pivoting. Yeah.
I think this is like, and it's a good space too to be like, it's not all doom and gloom, and that I think we have to understand our worth and what we need, and it's okay to sit there and tell a therapist, this isn't working for me. And Psychology Today is a great tool to find a therapist. You can sit there and say male, female, non-binary therapist, queer affirming therapist, religious-based therapist, and like, do not settle.
Yeah, don't be afraid to try out.
Yeah, 100%.
people.
And I know that some of it's like there's like the deserts of mental health services, but know that like,
Well, especially with prescribers too,
Right.
because you could get caught in a loop of like years of medicine after
Yup.
medicine after
Yup.
medicine, because some prescribers will give you something and be like, I'll see you in 3 months.
Yup.
And it's like, well, after like 4 appointments, are you going to decide they're ineffective? Because 4 appointments is like a
Correct.
year.
Yeah. Well, I think that's so many clients tell me, I'm so glad Anne Marie's doing Gene Sight for us, because I can like now have to take a medicine for 8 weeks and then find out it doesn't work. Because look, my sister, God, the word was there and I couldn't say it. My sister was also diagnosed with binge eating and ADHD, and her provider was like, well, especially if your brother has it, if it sounds like your mom and dad both have ADHD, which yes. So they put her on Vyvanse, and then my sister was telling me like, it's really hard to get my medication, like this, and this, and like I was like, then call your doctor, right? And she's like, well, I don't see him for another 3 months. I'm like, what? And she's like, yeah, like I did my initial appointment and then I'll see them in 3 months. I'm like, there needs to be a check-in 2 weeks at least. Vyvanse works immediately. At
Yeah.
least check in 2 weeks and then maybe discuss a longer period. But 3 months is a quarter of a year.
I
That's too
always
long.
do 2 weeks after
Yeah.
the initial intake.
Which is good.
Sometimes I hit the nail on the head, and by the second time I see them, they feel great, and we'll
Right.
go like three
Yeah.
or four. But I usually do every two until I
Yeah.
have someone stable.
And I think that's the responsible thing to do because, like, again, we never want to just be like, okay, bye, like, good luck. I
I mean,
did the
if we're
work.
doing our job effectively, people should be seeing minimally partial responses in 2 weeks.
Yeah.
Or like I change stuff all the time.
Yeah.
Like not in like a negative way, but in like a I'm not going to tell you to just accept this for another 6 to 8
Right.
weeks and
Right.
continue being miserable, and maybe like 5 months after you start seeing me, maybe you'll feel better. Maybe we'll be like,
Right.
it didn't work.
Yeah.
Let's try something else. Like time flies, man.
It
You
does.
gotta like get on it because people lose faith then.
Yeah. And I think 100% they lose faith because they're like, oh my God, it took me 9 months to get into this psychiatrist or this, mental health, medical prescriber. And now I have to wait another, whatever. Like, I think that's the thing is it takes so long that it like makes them, what are you doing?
I thought that like my bra was sticking out. I feel like it maybe was, but let's hope it wasn't.
Nah, I don't think so.
We'll
I feel like I
airbrush
would have
it if we
noticed
need
it.
to. I mean,
But no, I
hard to
think it's
say.
like a thing of where it's like it took me so long to get the appointment. I just have to like be happy with what I have.
Yeah.
And I think that the discussions we should be having then is like, can you give me a reference then? Or talk to your friends. That there's so many people that my clients will be like, I talked to so and so whose aunt is this. It's not like a conflict, and they're like, and they realize that like they could get in, to see either you and Anne Marie within like a week or two, and not like 7 weeks or 9 months or 3 years. I mean, someone was like, I need to see someone for ADHD, and it's a 9 month wait. I'm like, what? Like that's insane.
That's why
Like-
I keep spots open so I can see
Yep.
people within 2 weeks.
Yep. My Wednesdays, always on Wednesdays, I try not to like overwhelm. Now it's getting to the point where I have to schedule regular clients on Wednesdays, but I would keep Wednesdays completely almost open so that if there is crisis or someone that wants to be seen right away, I can do that because then I can just move them after that. But there are good people out there. I
Yeah.
promise. We promise.
Yeah.
There are. You
You just have to look for them.
yeah.
And like know what you're looking for.
Know what you want, know what you're looking for. Share resources with family and friends if you know they're going through it. Be like, there's so many times I've been like, it'd be a conflict if you saw my therapist, but I know that where I go is amazing and they have amazing people. And, let me check the website. Yep, 2 of the therapists are seeing people, new clients. So share the resources because I think that helps too.
Yeah, yeah. I'm very honest about like my referrals, and I'm very selective. Like I won't refer to therapists that I think are ineffective.
100% Sam. I'm not going to be like, I mean, at least you'll see someone. I'm like, no. Not the thing.
Yeah.
This was a fun one.
Yeah.
Yeah.
It was fun.
Let us know what we have some kind of things that we talked about today that might be, I guess, coming up in the next few weeks. And then we have some exciting things for season 2.
Season
So we'll have to do like
2.
a fun season 1 finale.
Ooh, what
I
are we
know.
gonna do? Maybe we can have Jason and Colleen.
Like a close off interview the
Of like,
host.
what is the most annoying thing that you
About-
do? I guarantee they would both say that we don't listen.
Oh, 100%. Jason
Yeah.
would be like, the other day he goes, I just was reading something or watching that said that people with autism will tend to say, after they heard something, say what, even if they understood it, because it gives them more time to think and react. I'm like,
Oh my God, I do that.
I do it all. Like Jason will be like, blah, blah, blah. And I'll say, what? And he goes, did you really not hear me? And then I'll answer before he even gets a chance to. And I'm like, it's literally just so I can think about something real quick.
Yeah.
And it's also was like such a common thing we did in my household. We would be like, what? That's what? As a way of like responding. Like the what was a response and not a question. And Jason's like, I think this will help us out a lot, 'cause it's really frustrating when you do that. Like, sorry.
I mean, when I say what, like 80% of the time I actually didn't listen.
You're like, no, I really didn't get it though.
Yeah,
I really didn't
no.
know. Oh my God, that's funny. All right, we'll see you next week. Feel free to let us know if you want something specific to be talked about. And yeah, we'll jump, jive, and whale with you guys.
Sounds great. Okay, bye.